What are functional labs? In this quick video, I'm just going to go over a couple slides explaining the difference between functional labs and conventional labs. So when I'm talking about conventional labs, I'm referring to the labs that your doctors conventionally run, the standard stuff that they're running at your PCP, even your endocrinologist, your OBGYN, the stuff they are typically running. And I always get women saying, my doctor ran all these labs and they couldn't find anything. And then I look at all these labs and it really wasn't that much, but the labs they are looking at are looking for different things. So it's not that much in terms of the stuff that I'm looking for, but they're covering entire, liver and kidney and all this stuff. And chances are your liver isn't failing, your kidney isn't failing. So we're not going to see things come up on those types of labs. So I'm just going to explain the difference between typically what your doctor is running and then what we run in our program and our practice, which is functional labs, which are very different. And it's also important to note that a lot of people say, well, oh, food sensitivity testing, I'll just go to my doctor. I'll just go to my gastroenterologist or whatever the person is. These functional labs are run by people who are trained in functional medicine. So dietitians who are trained in functional medicine, maybe some like naturopaths and things like that. But your typical insurance provider is not going to run these types of labs. So I just want to be clear. I get that a lot. People say, oh, what labs do you run? Okay, let me go run to my doctor and get it. You can't get these at your doctor. So let's dive in. So functional medicine, the goal is to look for root causes of symptoms and disease. I always call it an upstream marker versus conventional labs being more downstream. When things have already gone wrong, then it's going to show up, right? Symptoms are kind of like, and labs are a way of showing that something is going wrong, but we like to catch things beforehand, or if something is going wrong, figure out what is actually causing it to go wrong versus just treating the symptom, which is what happens when, for example, you go to the doctor and you have high blood pressure. Let's stick a medication on it rather than saying, okay, what's going on? Why do we have high blood pressure? Is it diet? Is it lifestyle? Is it genetic? What's going on? And how can we address it from a root cause versus just slapping something on to treat the symptom? So conventional medicine, I love this little phrase, is known for diagnose and adios. Again, they're looking for diagnoses. They're looking for labs that will tell them there's a diagnosis. They're looking for something that they can put a diagnosis on, because then they get insurance coverage and then they can bill for that, and then they can prescribe medications. So conventional medicine treats the symptoms and treats the lab values. Again, you'll see this a lot. They'll just say, oh, they'll look at what's low and high and say, oh, this is low, let's, treat this. Oh, this is high, let's treat this. And that's really, really basic. You're just treating a lab value and not the overall person. And that's where we're going to talk about that in a moment, but that's a big thing that functional medicine is different. So fixing lab values doesn't fix a person. Health is not just the absence of disease, right? It's not just, oh, these standard things that your doctor runs on your annual checkup are fine, then you're fine. And I can imagine a lot of you can relate and say, there's a lot of times where I haven't felt fine. I'm telling them I don't feel good. I'm tired. My hair is falling out. I'm cranky. I have acne. Something is wrong and my body is telling me, but the labs and the doctors say everything's fine. So health is not just the absence of disease or, a lab marker. So whole system versus body parts. With the functional medicine approach, we're looking at how all body systems are interconnected rather than just treating one symptom from one body part. Again, looking back at, let's use high blood sugar as an example. We'll just give you some metformin rather than looking at what's causing the high blood sugar in the first place. And again, we're looking at it from a holistic body approach, not just this lab is off, this system isn't working. Conventional medicine also focuses on specialists. That's the other really hard thing, because you have to go to one person to look at your thyroid. You have to go to one person to look at your hormones. You got to go to another person to look at your gut, rather than understanding that the body doesn't just operate as, this part's disconnected from this part. Everything is connected. So we have to look at it holistically. But our current model just looks at everything from one specialist to another specialist. I got these labs here, and this person gave me an opinion over here. And it's just so segmented. No one's communicating with each other. And it's just all a bunch of specialists that you have to wait months to even get an appointment with. I'm going to stop rambling. But in a functional medicine approach, everything is connected to everything. So functional labs, they go deeper than what one specialist is trained to look at. So for example, in my metabolic panel, we're looking at things that like you'd have to go to multiple specialists to look at. We're looking at thyroid, we're looking at hormones, we're looking at blood sugar and inflammation, we're looking at your heart health markers, we're looking at your anemia, like we're looking at so many things. And if you were to try to go get those from one doctor, you wouldn't be able to. So we look at things more than just one specialist could do. We're looking at things in our other functional labs. We're looking at things like micronutrients, food sensitivities, toxicities, gut imbalances. Those are some of the labs that we offer. Conventional labs are really just determined by what insurance will cover. Again, a lot of this is bound by insurance and having a diagnosis. So that really limits it. And again, insurance doesn't cover functional labs, unfortunately. You can use things like HSA, FSA cards, I will say that, but that gives us more freedom because we're not bound by what insurance allows and what you have to have a diagnosis for and things like that. Also, I found if it doesn't have a medicine or a pharmaceutical treatment, it's not worth running the lab. So thyroid antibodies are a great example. Thyroid antibodies are a indicator if you have something like Hashimoto's or Graves' disease, you have an autoimmune reaction on the thyroid level. And a lot of doctors are not running this because there's nothing you can do with antibodies from a pharmaceuticals perspective. So I've seen a lot of doctors either just not running them, or even when I've sent patients to them, they refuse to run them because they don't even know what to do with it. And so our thyroid panel, of course, has antibodies because there's a lot we can do from a diet and lifestyle approach. And again, that's giving us the root cause. If you're having thyroid imbalance, this will tell us if it's coming from an autoimmune place, and we need to take an autoimmune approach with healing your thyroid. So if it doesn't have a medicine, unfortunately, sometimes it doesn't get run. Another good example of that is leptin. We run leptin. Leptin is your satiety hormone. And we find not a lot, but we find that women can develop leptin resistance, which is meaning when that happens, then you're unable to get feedback from your body that you need to stop eating, essentially. So people will say, I just keep eating, I keep eating, I keep eating, and you may have leptin resistance. And there are things we can do, again, diet, lifestyle approaches to work on leptin, but there's no medication to slap on it. So we never see that run conventionally. And then last thing, in terms of the interpretation, there's a whole different approach. So I could even look at the same labs that your PCP ran and have a completely different approach and interpretation of it. So functional medicine, we're looking at more than just what's flagged high or low. A lot of times that's what your doctor does. They just kind of scroll through what was marked high, what was marked low. Okay, this is wrong, this is wrong. A 2-year-old could do that, or maybe a 5-year-old could do that. That does not take any science or any clinical thinking. So we are doing more than just treating lab values. We actually use optimal ranges when we're looking at our lab tests, because the labs and the ranges that you get at your conventional doctor are really big. They're actually based on the entire population, whether they're healthy or not. And we know that our population is fairly unhealthy. So we're getting data on ranges that are from unhealthy populations. So we look at optimal ranges. We look at what does the body need to function at a high optimal level. So we have much different ranges that we're looking for on blood sugar levels, on your thyroid levels, things like that. So I could look at your doctor's labs and have a completely different interpretation. But on top of that, I'm not just looking for high and low and just slapping us even a supplement on it. We are looking for trends. We are looking for root causes. We're looking for overlap between body system. We're looking at the big picture here. We are not just looking at that's high, that's low. We are interpreting it using our clinical experience, clinical training in the functional medicine space. So that is a quick overview of the differences and how we approach our lab testing. You can order our labs by starting with an application. We start with that just so that we can also give you feedback. You may think you know what you want to run, and that's a great starting point, but we always want to use our clinical judgment again to help guide you into the best test based on your background, your symptoms, your goals, things like that. So we start with an application, and then we move forward from there in running your lab. So I'm excited to dive into this with you.